Hello. Today we're going to be talking about childhood obesity, and we worked as a group in order to create this presentation, and my name is Sophia Harrell.
My name is Alexandra Mangano.
My name is Marissa McCormick.
I'm Jack Brady.
And my name is Marco Helms.
Okay, so our objectives today are to teach you guys a little bit about what childhood obesity is. We want to talk about the epidemiology of it, so the costs, the morbidity, the mortality, the prevalence, and stuff like that. We also want to identify the risk factors associated with it. We're going to talk about the negative health effects of childhood obesity, and then we'll finish up talking about how to prevent it and the treatments that you can use.
The CDC defines childhood obesity as a child having a body mass index greater than or equal to the 95th percentile. And that body mass index is found by taking into account an individual child's weight, height, age, and gender, and then comparing those results to the results of other children in the same categories. Childhood obesity affects children ages 2 to 19. A normal BMI for a 10-year-old boy, for example, should be in the 19th percentile, and an obese 10-year-old boy would be in the 24th percentile. Childhood obesity adds an estimated $14 billion more in healthcare expenditure costs each year. About 13.7 million children and adolescents are obese. There are different obesity prevalences amongst different age ranges. So from children ages 2 to 5 years old, there's a 13.9% rate of obesity. From ages 6 to 11, 18.4% of children are obese. And from ages 12 to 19, 20.6% of adolescents are obese. Research shows that nearly 1/3 of children and teens are either obese or overweight. However, 84% of parents consider their children to be at a healthy weight. So there's a clear discrepancy between those two percentages and the recognition of obesity and seeing a need to change.
So some major risk factors for obesity include poor sleeping habits. So when a child gets less than 8 hours of sleep a night, it correlates with a higher BMI. Another example is poor parental feeding habits, such as restricting food intake for weight loss, and that also affects the BMI. And a third example is children taking in more calories than they need to burn. So overeating contributes greatly to affecting BMI. Overweight children consume 700 to 1,000 more calories than they're needed per day. And then some groups at higher risk include groups of children living in rural areas. Children who live in rural areas show 26% more obesity rates compared to children in urban areas. Another group at risk is people in lower socioeconomic statuses. Obesity in children is closely tied to socioeconomic status, and which with each 1% increase in poor income, the rate of obesity goes up by 1.17%. And then the last group at risk is Hispanic and Black children. Hispanic and non-Hispanic Black children have higher obesity rates than non-Hispanic white children.
So there are a lot of negative health effects due to childhood obesity. Risk factors for cardiovascular disease, such as high blood pressure, high cholesterol. There's an increased risk for impaired glucose tolerance and insulin resistance, which can lead to type 2 diabetes. Breathing problems like asthma and sleep apnea. There's also joint problems and musculoskeletal discomfort. Fatty liver disease, gallstones, and gastroesophageal refluxes are also negative health effects. And then finally, psychological distress is a big negative effect. And children who have obesity are much more likely to become adults with obesity. And this is just generally because adults are less active due to like work and family and stuff like that. And adult obesity is associated with increased risk of several serious health conditions, such as heart disease, type 2 diabetes, and cancer.
So we're going to talk about some primary prevention actions against childhood obesity, which include ways that we can prevent obesity from even occurring in a child or stop it before it gets too severe. So the first primary preventative action we have is increased physical activity. And we said that children and adolescents aged 6 to 17 should be physically active at least 60 minutes in a day, and children ages 3 to 5 should be active throughout the day. We should also see an increase in sleep in children to prevent obesity, because too little sleep is associated with obesity, and inadequate sleep makes us eat more and be less physically active, which are again risk factors for obesity. Change in diet is a very important part of preventing obesity. It's recommended that there are plenty of vegetables, fruits, and whole grain products. And we should also include low fat or non-fat milk or dairy products like cheese and yogurt. We should choose lean meats, poultry and fish, lentils and beans for protein instead of red meats like steak or beef. And we should encourage your family to drink lots of water and limit sugary drinks like soda or juice. We should limit consumption of sugar and saturated fats. We should also implement school programs to prevent obesity in children. It's been seen that school-based programs were effective in preventing obesity, especially if the programs were longer than 1 year. We should finally limit sedentary activity like sitting in front of the television or playing video games or surfing the web. 2 hours of screen time per day is recommended for kids, but kids below age 2 are not recommended by the American Academy of Pediatrics to be sat in front of the television.
So now we're going to talk about some clinical treatment options, and these can be used when the preventative actions don't really seem to work and the children are still struggling with obesity. Some secondary treatment options can be like getting like a dietitian and changing your lifestyle, maybe getting a personal trainer, implementing more exercise routines in your daily life. Another one can be pharmacotherapy, which is, taking drugs that can help reduce the risk of obesity and other diseases. Behavioral treatment therapy, going to like a therapist or psychiatrist, and then treating other underlying conditions that can perpetuate childhood obesity, such as treating disorders like diabetes, thyroid disorders, and hormone imbalances. A tertiary treatment option that is only really used in dire situations, and if obesity still persists through like adulthood, is gastric surgery, but this is only used in very dire situations. And the last thing we're going to talk about is our infographic improvements. And the one thing we did need to improve was changing our prevention section to express different methods as primary, secondary, and tertiary. At first, we only had the methods for prevention as just general methods and not really explaining what each stage is. We just said healthy eating habits, encouraging physical activity, and reducing sedentary times. But we changed that to express primary, secondary, and tertiary, such as a primary action is implementing school programs to help reduce obesity in children before it can happen. Secondary is physical activity, which is if you do realize that you are obese or overweight, you can increase physical activity to reduce that. And then tertiary is if obesity still persists and you need to get medical treatment.
And then these are our references and citations to some of the resources that we used in order to come to all these research conclusions or educational conclusions. And as you can see, we use the CDC a lot. And here's some more.